Hi, I'm Jacqueline with Expert Insurance Team, and I'm so glad you're here today. Our goal in this quick webinar is to simplify Medicare and help you feel comfortable as you start this journey. By the end of this webinar, you'll have a better understanding of what Medicare is, the basics of Medicare, enrollment periods, and how to choose the best coverage for your needs. So let's get started. So, what is Medicare? Medicare is a federal health insurance for people age 65 and older, and for some younger individuals with disabilities or a specific condition like end stage renal disease. How is Medicare funded? So, Medicare is funded through your federal taxes. Once you're eligible to receive Medicare, the federal government will deduct that from your social security benefit. This plus what you pay while working will fund your Medicare coverage. Now, what Medicare option is right for me? So this is where I'm gonna explain to you the two different options with Medicare, and this will help you determine which option is best for you. I'm gonna give you a brief introduction into original Medicare and what Medicare Advantage is. So to start off, original Medicare. So this is also called your red, white, and blue card, which is known as original Medicare. And this has two different parts. It has hospital part A and medical part B. So it's two parts. Part A is hospital insurance, and this is what covers your hospital stays, your skilled nursing, and some home health care. So most people will typically qualify for Part A premium free because they worked here at least 10 years. You have to have worked at least 10 years to earn your credits. And you have to pay your FICA taxes. Now, Part B is known as medical insurance, and medical insurance will cover outpatient care, doctor visits, and preventative services and medical supplies. While there is a standard premium of $185 a month when it comes to Part B, there is also a deductible of $257 a year. So for 2025, you would have to pay $257 for the entire year. Medical Part B, though, only covers 80% of your services. So who pays the other 20%? You're responsible to pay for the other 20%. However, you can add a supplement plan, which is also known as a Medigap plan. And this will act as a secondary insurance card on top of your red, white, and blue card. This will cover the other 20% that Medicare is not going to cover. However, there is a cost with this. Typical cost usually ranges between like 130 to 185. It could be less, it could be more, depending with what plan you go with. And you can also add a prescription coverage, which is known as Part D. This is the card that you will show when you go to your pharmacy. This is what you will show them. So this is how original Medicare works. Your red, white, and blue card plus a supplement plan plus a Part D, which is your prescription coverage. Now, the question is, how do these cards work together? So let me give you an example here. Obviously, this is worst case scenario, but let's say you have to go up to Mayo Clinic, which is located in Rochester, Minnesota, and it's actually the building here I have in this picture. Let's say you have to go there, and you have to get $1 million, $500,000 worth of cancer treatments. So you're going to be walking into the building, you're going to show them your red, white, and blue card, which we just talked about. That's going to cover the 80% of your services that you're getting there. And then you're going to show them your supplement card, which is going to cover the other 20%. They say that nearly 95% of all doctors and hospitals in the United States accept your red, white, and blue card. So you're only going to be paying Mayo Clinic $257 because remember, that was the deductible for 2025. So you're going to have to write a check to Mayo Clinic for $257, and that's all you're paying. Everything else is covered by Medicare, by original Medicare and your supplement card. Another example here, this is obviously some, for smaller expenses. Let's say you are going to a doctor's visit, you're feeling sick, and they charge you $15. So you have a deductible of $257. So 257 minus 15, which is what the doctor charged you, leaves you a deductible of $247. So that's how two different examples. Obviously, one's very extensive. It's, worst case scenario. And then the other one's a little bit more if you go to just a doctor checkup. With original Medicare, you'll carry 3 cards. So you're going to carry your red, white, and blue card. You're going to carry your supplement card, which is also known as your Medigap, and you're going to carry your Part D prescription card, which is what you show at the pharmacy. So you're going to carry 3 different cards if you would go with original Medicare. Obviously, original Medicare covers comprehensive coverage, but it does cost money and it will increase every year slightly. Your other option is Medicare Advantage, which is also known as Part C. And this is mostly known as an all-in-one plan. This offers the same coverage, has original Medicare, plus added benefits that may include dental, hearing, vision, prescription plan, and also gym membership. By choosing Medicare Advantage, you are no longer going to be using your red, white, and blue card. You're going to be putting that away somewhere in your home where you don't have to carry that with you anymore, because instead you're going to replace your red, white, and blue card with only one card that is from a private insurance company. So if you go with Medicare Advantage, you'll have to follow the rules, which means you have to use their network of doctors and hospitals. And it is a plan that is known as a pay-as-you-go plan because there's a lot of co-payments. Co-payments can range from $15 to $20. There's 3 things, however, that are important to know about Medicare Advantage. That do not cover. You have to pay 20% for these 3 different services. So number 1, durable medical equipment such as oxygen tanks, wheelchairs, you have to pay 20% of those costs. Secondly, dialysis for kidney issues, you have to pay 20% of those costs as well. And lastly, cancer treatments such as radiation, chemotherapy, you're paying 20% until you reach the plan's out-of-pocket maximum. The plan's out-of-pocket maximum can range between $3,000, $4,000. It just really just depends with what plan you go with. The good news about Medicare Advantage is that the plans are typically $0. That's all you pay per month, $0. You still have to pay the $185, which is Part B. Remember, we talked about in the beginning, you still have to pay that no matter if you go with original Medicare or if you go with Medicare Advantage. You still are paying that premium. So how do I sign up for Medicare? Let's talk about when you can enroll in Medicare. So initial enrollment. So if you're already collecting Social Security, you'll be automatically enrolled in Medicare Part A and Part B 3 months before your 65th birthday and 3 months after. So the premium will be deducted from your Social Security benefit. Now, manual enrollment. If you're not collecting Social Security, you must enroll yourself. You can do this by visiting, going online and going into the Social Security and doing this yourself. It only takes about 15 minutes. However, we will be glad to help you with this. We've done this with many clients where we walk them through the process and we show you how to do it. I know it can be a little bit intimidated, so this is where we can help you. Or if you want, you can visit their office, Social Security office, and typically they will help you there as well. Another key enrollment period is known as annual enrollment. This goes from October 15th through December 7th. Each year, you can switch, you can enroll, or you can drop a Medicare Advantage plan or a Part D plan. The other key enrollment period is called open enrollment, which starts January 1st to March 31st. During this time, you can make a one-time switch to disenroll from a Medicare plan, switch to another plan, or return to original Medicare. And lastly, you have special enrollment period, which is triggered by events like losing employer coverage, you're moving, or you're qualifying for subsidy. So these are the three key enrollment periods. There's annual enrollment, open enrollment, and special enrollment. Now let's talk about Medicare penalties because we often get asked, I heard that there's penalties if I don't sign up for Part B. Is that true? So let's talk a little bit about that and how we can avoid those penalties. So when you're getting started with Medicare, it's important to figure out whether you should sign up for Part B when you're turning 65. Now, this depends if you have other health insurance. Most people sign up for Medicare during their initial enrollment period. That's when you're first eligible to sign up for Part A and Part B. Remember that starts 3 months before your 65th birthday and 3 months after you turn 65. Now, if you don't sign up for Part B during this period and you don't have other coverage, you will have to wait until a specific time of the year to sign up. This means that you will go months without coverage, which you might have to pay a permanent Part B late enrollment fee, which goes up the longer you wait to sign up. And that penalty, if you wait, is 10% penalty, which is added for each year you delay enrollment. So without credible coverage, you will get 10% penalty. For example, you go 4 years without signing up for Part B. This results in a 40% penalty. So you're paying on the 185 premium. So you're paying 40% for the 4 years that you went without Part B. The next one is Part D penalty, which is your prescription coverage. A 1% penalty is added for every month you go without coverage. For example, a 5-year delay, which is 60 months, adds a 60% penalty to the average premium. So if you're still working and have credible coverage through an employer, you won't face penalties for delaying Parts B or Part D. However, once that coverage ends, you'll need to enroll in Medicare during a special enrollment period, which we talked about in the last slide. Enrolling in Part A is often a smart move to do because it is premium free for most people and it doesn't conflict with your employer insurance. Unless you're contributing to an HSA, then it does affect it. However, if you're still working, you have employer coverage, there is nothing wrong with enrolling in Part A because it is premium free. You're not paying anything for it, so you might as well take advantage of that. So the key takeaway from this is that failing to enroll in Medicare on time can lead to lifelong penalties. And when I mean lifelong, it's permanent. It will follow you forever. So it's crucial to plan ahead and avoid unnecessary costs and ensure you're covered when you need it. So I know navigating Medicare can be confusing. It can be a lot. It can be stressful, but that's why we're here. So I can help you simplify the process, help you compare your options, and ensure that you choose the best option that fits for your healthcare needs and budget as well. So there's 3 things that I want you to know before this webinar ends. We always get asked often, do we charge for services? And we do not charge for our services. They're completely free. However, we do get paid commissions by the carrier, by the insurance companies, just like your auto, just like your home insurance agent. So this does not affect the cost of your policy. We just get a commission from the carrier itself. And then this next thing we often get asked is, do plans cost more if you go through us? Absolutely not. You'll pay the same price whether you go through us or you search online. You see the same price. Insurance companies are more than happy to save on commissions. So if you go directly to an insurance company, if you go directly to Blue Cross Blue Shield, for example, um, they're going to sign you up. They don't pay us commissions. They're more than gladly to cut us off and just sign you up automatically. So but our expertise will help you make the best decision for yourself, where we can help you see your options and what works best for you and your needs. And lastly, we often get asked, do you prioritize higher commissions? We do not. Our top priority is finding the plan that best fits for your needs. So if you decide you want to go with a plan that is called, like a company that's called Joe's Chicken and Waffles, we will go with that. If that's what you want to go with, we will go with whatever you feel like is best for you. However, we will be recommending you the best one that we think is best for you. And we usually go on three different things. We usually look at the plans and we base it off whether it's popular, affordable, and whether it has a lot of people on the books. Because if it has a lot of people on the books, that means that if one person gets sick out of that group of people, the company will have an easier time spreading that bill amongst everyone. So those are the three things that we always look at when we look at all your different options. Um, I hope that this webinar helped you understand Medicare a little bit, and you can schedule your free consultation. There is a link to my calendar. That's the very first one you see there. Or you can also give me a call. That's my work number, or you can email me. So whatever works best for you, we look forward to helping you make the best decision for your Medicare coverage. And I just want to thank you for your time. And I hope this webinar was helpful for you. And we hope that you have a great day.